Hello, everybody. Thank you for having me. I'm pleased to be with you at Hanover Cares Coalition. We've got lots of things to talk about today in a short amount of time. A little over a month ago, our wonderful General Assembly in Richmond passed Senate Bill 1406, which legalized simple possession of marijuana for adults up to 1 ounce of leaf marijuana. So just to let you know, this little baggie is about 1 ounce of marijuana. Okay, it's a spice that I bought at one of the big box stores. So this is about the size of 1 ounce. So this much marijuana would be legal, simple possession. So this is about, could make up anywhere 30 to 50 regular marijuana joints. So that's what's going to be legal under simple possession. So also within this new law, it allows for adults to have 4 marijuana plants in their house. And it's going to create the development of all these organizations here. You see the Virginia Cannabis Control Authority, the Cannabis Oversight Commission, the Cannabis Public Health Advisory Council, and the Cannabis Equity Reinvestment Board and Fund, the Cannabis Equity Business Loan Program and Fund. If there are revenues from marijuana taxing, applications, sales, etc., that will be divided up into pre-K education, into prevention education services through DBH, and through public health awareness campaigns. So, and we'll get into some of that a little bit more later on. So they've got lots of other bills were added to this. This whole bill is something like 283 pages. I've scanned it 3 times, but there's lots of non-marijuana sort of tag-alongs, information about these structures of these groups that they're going to be developing, the ABC board, definitions, judicial practices. So it's pretty complicated. And I want to let everybody know that there could be a special session called this summer, and they could kind of tweak some of these releasal dates, because marijuana is supposed to be legalized for adults July 1. And then the plants can be grown as of July 1, but some of these other provisions are going to start in a couple of years after the marijuana grows in these businesses and they pass or they refine things. Also, so there could be a General Assembly special session this summer. And there's going to be a reenactment next General Assembly, which means they have to vote again on this and kind of pass it again to make sure this is what they really want. Okay. So, and during that time next year, when we can help influence General Assembly and say we want our area like Hanover to opt out and not allow these businesses to sell like the commercialized marijuana. So there's still much that could change and that we might influence to change. So stay tuned to all of this, y'all. What does all this mean for Virginia? So I put here that there are 17 states. So really what that means, what I meant by that is 16 states plus the District of Columbia has allowed adult use marijuana legalization. But we're only the 4th to pass this legalization through legislation. So all those other areas, states, and have passed it through the voters directly voting on some kind of amendment or a certain bill, so a special voting. The thing that you're going to see when this bill continues to roll out is the emphasis of General Assembly is not on health, like our coalition emphasis would be on prevention and health. The emphasis is on social and racial justice. That hence the reason they're having more of these equity committees, started and funding for small businesses. So this bill will not allow more than one individual to have more than one marijuana sort of growing area with a store attached to it. And that's where vertical integration comes in. Okay. So you have to grow it, process it, sell it, all that. So that's the vertical integration. So they want these micro businesses, they want mom and pops basically to sell marijuana. So, yes, it's good to have a harm reduction approach. And it's also good to address social and racial issues by not targeting certain neighborhoods, by not racially profiling, by looking at policing and procedures and being more equitable. So I tend to think there are some other strategies we could have taken that rather than doing this. Also, in the other states that have legalized marijuana, they're not seeing the revenues, especially initially, like the first 10 plus years that they expected, because of loss of work productivity, car crashes, insurance rate, academic work underachievement, all that. So let's look at, what are the risks of marijuana and legalization? So we have some troubling data out of these states like Colorado that's legalized like 10 years ago. So we can look at this longitudinally and see how pediatric exposure, which is basically poisonings, has increased. And this means like acute ingestion from having, consuming too many of these edibles. And that can change the consciousness, the awareness, changes in behavior for kids. And that's why the American Academy of Pediatrics has said they oppose legalization of marijuana. And you all might be aware of some of the side effects, either the physiological or the psychiatric side effects. So psychiatric might include, panic attacks, seizures, hallucinations, acute marijuana intoxication, those kinds of things. And physiological might include the heart palpitations, exposure to carcinogens, cognitive impairment, slow reaction time, reduced peripheral vision, reduced testosterone, compromised executive functioning, reductions in memory. I mean, need I go on? Some of this is caused from higher levels of THC. And right now, in this new bill, Senate bill, what is it, 1604 or something, doesn't have any provisions. No, it's 1406. I got my numbers inverted. 1406 doesn't provide for a cap on THC levels. Okay, so that's going to be very troubling. And one new phenomenon that we've been seeing over the past couple of years is called cannabinoid hyperemesis syndrome. And that is severe stomach cramping, vomiting, nausea, to the extent that individuals have to go to the emergency department. And that's all due to higher levels of THC. So we know that can happen to adults, that can certainly happen to children and youth. Another troubling statistic I want to point out here is collected from Parents Opposed to Pot, who scanned newspaper articles from around the US and found that over 250 deaths were attributed to parents being under the influence of marijuana and causing a death in their child. So we've got some troubling stats there. Youth marijuana use. We can travel to the bottom of the ocean. We are collecting data. We're in outer space. We're collecting data, but we don't have data collected around Virginia on a regular basis. We don't have any baseline data from around the state. And as far as I know, in this bill, there's no provision for collecting data on a regular basis, so we can see how this bill may have impacted us. But right here, you see some national data, okay? So we see how drug use has increased during the pandemic. This is out of JAMA Pediatrics recently. So marijuana use and other drug use has increased during the pandemic. And look at this, 1 in 3 high school students has used in their lifetime, okay? So when they've conducted these what's called prospective, which is like a future projection of marijuana risks for young people, they compare non-users and regular marijuana users and see that those who would use marijuana on a regular basis starting in youth would have poorer life outcomes. So that would mean, more substance abuse, health problems, tobacco, alcohol use, and maybe not be in a significant relationship when they get to be an adult. So that means their life skills, their coping, communication skills are thrown off. So we've got right now in Virginia, according to SAMHSA, though, this is national data they take, it's not as many in their population sample, but the 12 to 17-year-olds, 5% have used in the past month, and 23% believe that that only 23% believe that it's risky to use monthly. So that means a huge majority of young people think that it's okay to use marijuana. Let's look at the young adult use rates here. This is where there's the most or the greatest amount of drug use is during this 18 to 25-year-old. So these would be our college students, those students in trade schools, maybe some high school students entering the workforce, coping with the pandemic. So we see the numbers here that initiate marijuana per day. And that was a couple of years ago. So perhaps during the pandemic, there's an increase here. And they're beginning, though, to maybe age out a little bit, some of them. So they may begin, and then at the end of this age group, they may start to what's called age out and not use anymore, so begin to see some of the risk from their regular use. That's the only good thing possibly about this, unless they develop a substance use disorder. Will youth be impacted by legalization? And I say yes, because we can compare the legal states and look at those youth use rates from a couple years ago to the non-legal states. So Virginia was in that non-legal state category when this data was collected. And Virginia has lower youth use rates than other non-legal states, and certainly lower than the legal states. So we see in the legal states, use goes up, vaping marijuana goes up, school suspensions go up. And there's other behaviors that get tied into all this too. What's troubling to me also is that we have only to look at other drugs that have been legalized, such as alcohol and tobacco and vape products, to see how vulnerable all youth are to this marijuana legalization. And despite the state saying they're going to control it, we know that youth still have access to tobacco and alcohol products. It's readily available. It seems to be normalized in our country, and it's acceptable in our culture for the most part, unfortunately. Unintended potential consequences. I have a plethora of these here, so I won't read them all. But some things I'm concerned about, I want to focus on, and that is we're still in a pandemic, even though about a third of the adults in Virginia have been vaccinated. We're in a financial recession, and just last year, Virginia decriminalized adult simple possession of marijuana. So we still haven't allowed enough time for that to play out, especially during the pandemic. So we have, we just don't, and we don't have any baseline data, and we can learn from other states that have been collecting longitudinal data to know that there can be very real negative consequences, even though they're unintended. So we've seen that for every dollar collected in potential dollar collected in revenue, the state might have to pay out $10 because of marijuana legalization and availability. And this is similar to alcohol, okay? So these deficits, that there's generally a deficit in these budgets. And it's perhaps over time that'll equal out, but we just haven't seen that. Another issue here, unintended negative consequence, might be from the home grows. When you're allowed to have 4 plants in your house, this new law would say you can't have it in sight from the street or the public. You can't have those plants. You can't let under 21 around it, and you can't grow more than 4. But how are you going to keep kids in a house away from your plants? You know, they're going to see it. There could be a nuisance to the neighborhood. There could be trafficking. This could become a little cottage industry for some folks. And by the way, the law allows for gifting or sharing of your marijuana as long as it's under an ounce. So if I want to help subsidize my retirement, I don't believe in smoking it. I could grow it and then sell it to somebody else. As long as it's under 1 ounce, it would still be legal. Very interesting problems. Again, another potential consequence is that the state hasn't quite figured out what to do with the seed to sales. So you're not allowed to possess marijuana seeds, but how are you going to grow the marijuana if you don't have seeds? So it's all very confusing. And I mean, just stay tuned. It's going to be crazy rollout of this. So let's talk about something positive, what we can do and who can do it. These are some of the key strategies developed by CATCA, not SAMHSA, CATCA. So first off, we need to look at information. We need accurate information. And I would say that begins with our use of using appropriate terms. So smart approaches to marijuana and some of these other, like SAMHSA, some of these other groups have made some suggestions that we use the word marijuana and not the word cannabis, because cannabis is used by that industry. It makes it seem softer and safer. It's kind of the Latin word cannabis sativa, whereas we all know marijuana as an illegal drug. Okay, so we'll use the word marijuana, and we're trying not to use the word medical marijuana. We're trying to use a different word, like, you know, recommended by your provider. I prefer that we not use the word black market, but instead use the word the illicit or illegal market, and that we use the terms marijuana storefront or pot shop, not the word dispensaries. Again, that's a term used by the marijuana industry to make it seem softer. And we also suggest that we use the term substance use disorder or youth who use, not the word pothead or addict. Okay, so we need to debunk some of the myths. We need to expand our reach and our depth, educate adults, educate youth, you know, look at expanding all this information and communication, and keep collecting baseline data data, I should say, from a number of different sources like poison control, AAA, faith-based, women's shelters, etc. So another strategy is enhancing skills. So this would be skills of our youth and skills of adult children who might be living with their parents, or adult children who have substance use disorders or mental health issues. We need to look at educating adults, senior citizens like me. You know, we're a large cohort, a growing cohort of marijuana users, apparently. So we need to look at all the life skills, coping, communication, ways for folks to feel empowered and resist any kind of invitation to use or to grow it. Look at stress management. In this day and time, we certainly need to look at stress management. So enhancing skills, and I know coalitions are really keen on this, as are some of the secondary and tertiary prevention, you know, are indicated and prevention strategies. So providing support. And support is for all of us because we're all challenged with the pandemic and recession, etc. So other ideas for support are for along that whole continuum of non-users, those who are just initiating use, those who use in a problematic way, those who abuse, those who become substance use dependent. Okay. And we know it doesn't take youth very long to become substance use dependent. So we need to, intervene early and provide support. And that's where these mentoring groups come in for those in early intervention, treatment, and recovery, work with all different sectors of our community to address their policies and procedures, looking at those policies and procedures for staff, students, employees, CEOs, everybody on down the line. I called one of the major hospitals here in Virginia Beach, and they really didn't even want to speak to me about this. It's going to take a while for people to kind of catch on and realize they need to start addressing this. Okay, another area of support is through Marijuana Anonymous. I know unless you're in recovery, you can't just offer a 12-step support group, but working with the recovery community and inviting them into a space, encouraging them to establish more MA groups. And you can learn more about MA through their website. So also a major concern is marijuana use by pregnant and nursing mothers, just like with alcohol. The marijuana, especially with high dose THC, can be an issue for the developing fetus and for the newborn. Another strategy is to change access and barriers. So work with our city planners for these kind of buffer zones. So I put in here to make sure that like a marijuana storefront isn't around kindergarten all the way through college years, let's say. They're not around daycare centers or parks, libraries, drug treatment centers, etc. So keep those marijuana storefronts in more light industrial or sections, certainly not a commercial or residential area. Okay. So that means, kind of presupposes we need to get hip to the policies, procedures, the laws, the historical context of our communities. Another change might be limiting the time of sales from 9 to 7, not all day long. I mean, all night long, close at midnight. Okay. And, look at really increasing our access to prevention services in those skill buildings. Another strategy is to look at changing consequences. So one of these might be ensuring that these marijuana storefronts don't allow, say, under 21 in there to just look around. We have age limits. So we want to increase any kind of incentives for, pro-social behavior like prevention, like following the law, and try to initiate any kind of those surveys that we take of tobacco stores and vaping stores to make sure they're in compliance. So we need to make sure that there is a routine surveillance set up of the growers and those who are selling. We need to really somehow encourage development of testing, roadside testing. We have roadside sobriety checks for marijuana, but there's no such quick, reliable, inexpensive test for marijuana. Also, looking at consequences, we need to initiate a standardized testing for anyone killed in a car crash, or involved in a car crash, so we know if marijuana was involved in that crash, and that'll help us collect more information with these toxicology reports. So that means, we just need to expand our reach into more professionals in the community and get them involved in awareness about marijuana, the risks, and helping us track it and educate about it. Okay, yet another strategy is looking at physical design. So this means looking at real signage, in public places, to making sure we don't have marijuana stores being advertised, making sure that the stores don't have a big green flashing, neon light in the shape of a cross. Have you seen those green crosses? And that represents marijuana, or the marijuana leaf. We have a marijuana green leaf at a hemp CBD store down the street from me here in Virginia Beach. So this whole hemp came out as a product a few years ago in Virginia, and that has really blurred the lines. When people see a CBD and they know that CBD is in marijuana, they think, oh, marijuana must already be legal, so it's okay if I use it or buy it. We also need to, follow the model from the Virginia Department of Pharmacy in terms of making sure that any of these marijuana stores don't have lots of erroneous information on their website. They're not making false claims, that they're checking IDs, there's accurate labeling on all the products. So just a number of things. I mean, so physical design can be a space as well as what's on the product itself. Looking at modifying and changing policies here. Again, the opt out, looking at norms. And I think it's important for us to consider addressing maybe small issues like odor. If there's a neighbor that has an odor coming out of their house, if there's one of these marijuana storefronts that's odorous, we can take issue with that. Looking at home deliveries, making sure that that's limited. We can confront this whole cottage industry concept, this whole idea of sharing or gifting your 1 ounce of marijuana. It's just, so there's lots of issues, maybe large and small, we can take a look at, okay? Also, I would say we need to work with our school resource officers, security officers, police, to be as equitable as possible and not target certain communities, and then turn a blind eye to other communities. Let some people get off, and other people get charged harshly. So we need to look at equitable practices around our whole community. We've established that everybody has a role to play, even people we hadn't maybe thought about in the future, in the past, enlisting all different sectors of our community, and really stretching out and being as creative as possible. And we all need to think of a way we can take action, in our jobs, in our families, with our neighbors, with our communities. Now we have questions, and you all sent in some questions, and you may have other questions. So I guess, Octavia, you'll be looking at the chat box in case other questions come up. So what was already legal in Virginia? I think that's a great question, because as I mentioned, we had hemp, and hemp is a cousin to marijuana. It has higher levels of CBD, cannabidiol in it, but lower levels of tetrahydrocannabinol, which is the psychoactive ingredient, okay? And hemp has classically been used for its fiber. It doesn't typically grow real well in Virginia. But guess what? Better living through chemicals, So there's more of hemp being grown and sold. And hemp, they say, can be infused in all these products, from hand lotion to, I don't know, tinctures and ointments and whatnot. Then, so that hemp's been in our state. Then a couple years ago, they allowed marijuana THCA oil and CBD oil to be grown. And there are 5 different marijuana processors around the state, okay? So that's been going on for a couple of years. And then just last year, the General Assembly decriminalized marijuana use for adults with a low amount of marijuana. Okay, so this has been a slow creep through Virginia. And we've seen it as preventionists, and as Secova, we've been in Richmond talking, educating, advocating for prevention and not for this slow creep of marijuana expansion in our state. But the legislators have just been on this roll to make this happen, apparently. So the second question here, what are the dates for rollout? So this July 1, apparently, it'll be illegal for adults to possess marijuana, 1 ounce or less in Virginia. They cannot use marijuana in public. they cannot share it in public. So there can't be this transaction going on in public. And there can be home growing, as I mentioned, of the 4 plants, but they can't be in public view, can't have under 21 around it, etc. But according to what I've read in the bill, the retail sales would roll out in 2024. Again, unless there's a special session or there are changes in this whole reenactment voting. And that may change based on our election that's coming up this fall. So the third question here is what will be legal? We can't possess over an ounce of marijuana. So that's this much. You can't have over this much. So, you're going to have to measure, weigh it. They're going to have to look at it, etc. No more than 4 plants. No seed to sale provision, as I mentioned. And there's just all kinds of kinks and quirks in this bill. So as I said, I think it's going to be a little bit messy and irregular for a while. So stay tuned. So who and what age will be able to access? So 21 and over. Okay, so anyone in that age group. Of course, you can't be intoxicated. You can't go into a marijuana storefront and be. I don't know how they're going to gauge being stoned with marijuana. I don't know if they're going to. I don't know how that's going to look. But apparently, in the law, it says you can't be you can't be intoxicated or under the influence in order to purchase. Okay, yet another question. Consequences. So if you're under 21, there is a $25 fine if you possess an ounce or less. Okay, and then it just goes up from there if they have multiple infractions. Of age people would get a $25 fine if they use in public or they share in public for their first offense. And then mandatory drug treatment for the second offense. And the third offense would be class 4 misdemeanor. If there's more than a pound of marijuana, then that's a felony. Okay. And if you're growing more than 4 plants, that can be a felony. Okay. But that's presupposing that there's going to be enough officers to enforce this and enough kind of political will to enforce this in Virginia. So as I mentioned, I didn't see in the 283-page bill any limit on THC content. So, and with new growing techniques and with all the fertilizers, pesticides, all the chemicals, which again adds to the poisoning problem for pediatrics and everyone involved in any kind of growing operation. The THC content continues to rise and cause more and more problems. So I didn't see any limit on THC. If anybody sees that or hears that, please let me know. So there is a very definite conflict here with federal law, because federal law says that marijuana is a Schedule 1 substance in there with heroin and other addictive, unhealthy drugs. So the DEA has not changed that. The FDA keeps saying they're going to look at marijuana, but I haven't heard anything about that. And a couple years ago, a few presidential administrations ago, the Attorney General decided not to enforce some of these marijuana laws, even though the DEA hadn't changed their scheduling yet of marijuana. So there's been this slow creep nationally towards legalization as well. So more questions here. Are there any protections built in to address reductions in youth use? I didn't see any in there specifically. So as far as the funding allocation, so that's the next question here. Given any potential revenues, they say that 40% of revenues is going to go to pre-K programs for 3 and 4-year-old at-risk kids. Then, so that's 40%. 30% to the Cannabis Equity Reinvestment Fund, then to only 25% to DBHDS, Department of Behavioral Health, for substance use disorder prevention and treatment programs, and then only 5% to public health programs to help with awareness campaigns and driving under the influence campaigns. So that really leaves just less than a third of any monies collected to looking at protections for youth, education, etc. So, and I pretty much answered that last question. Prevention, that would be only 25% going to behavioral health statewide. We won't have a lot of money to work with, especially extra money, especially the first couple of years, because I don't anticipate much profit. And there are all these new funds and groups on advisory boards that need to be set up. And so there's going to be an outpouring of money by the state to set all this up, despite us being in a recession. You can tell I'm not very optimistic. So any other questions, Octavia, or anyone else?
I have a question about, you mentioned when you were talking about all of the strategies that you were saying could be recommended and implemented. Do you have any knowledge of how or if any of those have been implemented in the states that are already have legalized marijuana, and how long, like for example, like Colorado, longer, the 10 years, how long did it take for them to implement these, and what could be takeaways, for Virginia from those?
That's a great question. And yes, many of the Secova folks and myself have talked to folks from these other legal states. We've been collaborating with them. It takes a while, as you might imagine, to get new school curriculum initiated, to collect more and more data from different sources, to work with legislators. So they haven't pushed back the law, let's say in Colorado, but what's the number on that? I would say close to 80% of the counties, of the jurisdictions in Colorado have opted out of marijuana sales. I'm not kidding you. So they on a small, so if they can't change the state, they're changing in their communities, in their neighborhoods. You get what I'm saying? So that is powerful stuff. The problem with that is that there's a few counties left that sell all the marijuana in that state. So that's really driving it. As you may have heard the statistics on some of these areas, there's more, what's the word for that? There's more marijuana storefronts than there are Starbucks and McDonald's in those areas. And that's data from a couple years ago. So we know that's problematic. Also, if an area opts out, there's no guarantee that there's not going to be illicit sales, because marijuana growing, the legalized, they have to log how many plants. There has to be a tag on all the plants, just like here in Virginia. If you want to grow your own, you're going to have to tag your own with a special number and whatnot. So they have to tag it, and then they have to report to the state what their sales were. So what they see is the discrepancy. There's this many plants grown and this many plants that are sold in the state. So where's the rest of that going? So they suspect that there is, illicit sales to other states. Okay. So, and to maybe in counties that have opted out. So we take all these steps forward as in terms of your question here, as preventionists and educators, and then there's still all these additional roadblocks and challenges and ways to work around it. But yes, there are many prevention coalitions, organizations, nonprofits all around U.S. in these legal states, and we have Smart Approaches to Marijuana, which is an international consulting, educating, lobbying body for all of us. Excellent. Go to their website, Smart Approaches to Marijuana. Lots of good information there. So we continue to educate. Thank you. Any other questions?
I'm just checking in because it seems like, as you described, we have a great opportunity to really educate our county administration, our board of supervisors about,
Yeah.
I mean, we have this window right now, don't we?
Yes.
To
Yeah.
help them understand. I mean, the Dillon law in Virginia is very strong. So
Yeah.
opting out is a strategy that we certainly could look at, it sounds like, and really advocate for.
Exactly. Exactly. And I've talked to our city council here in Virginia Beach. I've emailed and talked to my legislators. And sometimes it feels like, we're banging our heads against a brick wall. But we have to remember, change happens over time. And do you remember that story about the butterfly effect? It may not take much to cause a change. And I spoke at one of these subcommittees, of course, by Zoom, during the General Assembly, and had all my arguments, because you're given 3 minutes. And don't you know, one of my arguments was later repeated by a legislator for his rationale for voting down this bill. So, it could have influenced his decision. He may have voted yes before and then decided to vote no on it. So we just need to keep planting those seeds, no pun intended, and hope that we can make a dent. Keep sharing information. Thank you.
Mary's contact information is here on the slide, as well as mine. So if you think of anything or have any further questions, feel free to drop it in an email, and we'll be sure to get your question answered.
Yeah. Well, thank you for having me. Good luck to Hanover. You've got a great coalition going there, one of the best in the state. So let's continue to work together and work with Secova and addressing all these challenges that we have. It's not going to be easy for us prevention people. Thank you.